Good morning, and today I'm going to be explaining to you how to assist in a medical emergency. This specific medical emergency is a patient with a diabetic emergency. So either hypoglycemia, which is abnormally low blood sugar, or hyperglycemia, which is high blood sugar. And so first we're going to start off with our patient that has hypoglycemia. Diabetic patients have difficult times keeping their blood very stable. And so most of the time they have something with them that keeps track of how low or high their blood sugar is. So a patient with hypoglycemia, there's either too little glucose or there's too much insulin in the body, and their body is starting to react. And so we have our patient here in the supine position. And so some signs and symptoms of a person with hypoglycemia, they start getting irritated easily, their hunger, slurring of speech, they can get confused, sweating, and then they can actually possibly lose consciousness. And so I'm going to show you how to react and how to respond for someone that's going through that. And so first ask if there are any changes in their medications or in their meals that day. And then, like I said, most people who have a problem with either low blood sugar, high blood sugar, they usually have something on them that can measure that for them. So if they are conscious, go ahead and have them check their blood sugar. And if the patient is laying down in a supine position, we're going to slowly move them to the upright position. We're not just going to move them. We're going to slowly move them, because if they get up too fast, they can possibly faint. They can fall. They can hit some of our equipment, and, it'd be a lot worse. So we're going to slowly pick them up in the supine position. And then we're going to, if the patient is conscious, we're going to administer them carbohydrates like 3 to 4 glucose tabs, 4 ounces of juice, or a tablespoon of like sugar or honey, something to raise their blood sugar. But if the patient is unconscious, we have to call 911. We're going to place the patient in the supine position, or the doctor can administer an IV, which is an intravenous dextrose, or an IM, intramuscular glucagon. And then if the patient is hyperglycemia, which is abnormally high blood sugar, and it's not just like, oh, it's a little high blood sugar, it's just, passing it. Like, no, this is like dangerously high blood sugar, like dangerous to the point where the patient's like, sometimes their life is like on the line. And so some signs and symptoms of hyperglycemia includes excessive urination, excessive thirst, rapid pulse, their mouth is dry, they have low blood pressure. Patients with hyperglycemia either are taking too much glucose or not enough insulin, because the insulin helps break the glucose down. And so if they're not taking the insulin, then of course they're going to have high blood pressure. And how to respond to a patient that is going through that, we're going to ask the patient when they last ate, if they had any, if they've taken any prescribed insulin, and if they are responsive, have the patient self-administer the insulin. If it is not responding, go ahead and call 911. Do not give them insulin. And then be prepared to provide basic life support if the patient does become unconscious. Thank you.